So the limitations, as I'd mentioned, is that these are non-dynamic. These are models that predict outcomes, at the time of diagnosis and might predict the 10-year or 20-year outcome. And I think what really is important in thrombosis is to be able to predict things dynamically in a short time frame, because thrombosis is an acute event that can happen really at any time. And it's a recurrent event too. So unlike disease progression to myelofibrosis, which takes a long course and really happens only once, thrombosis is a recurring event that happens more acutely. So I think you need a dynamic model, but the current one is a static model that assumes unchanged risk. It's also binary, and it's not really personalized. So these are some of the challenges. But the other challenge I think that's very important to point out is people under this model or patients who under this model are considered low risk generally, tend to stay low risk until they have a blood clot or until they turn 60. So in clinical practice, it's not something that really makes a lot of sense. The high risk patients also, once they're committed to being high risk, they're almost committed for life to a treatment regimen that might be intense. And so it's important to be able to kind of personalize those models to the individual patient over time, and not to label somebody with a risk category that they're stuck with for the rest of their lives.